Welcome to Charter Local Edition. My name is Brad Pomerance, and we are joined by Ron Kind. He is a member of the U.S. Congress from Wisconsin. And so I want to speak with you about an issue that's really percolated up to the zeitgeist recently, dealing with the minimum wage.
Right.
We know some states have higher minimum wages than the federal government. In Wisconsin, same level as the federal government.
$7.25.
How is that for the folks of the great state of Wisconsin?
Well, I think it's time for America to get a raise. It's been 7 years since we've had a minimum wage increase. If it had kept pace with inflation since 1968, it would be at $10.72 today, not $7.25.
And in terms of productivity, it could even reach $16 based upon those figures.
It could, yeah, and it's the smart thing to do for the economy too. When people have more disposable income, they're going to be out shopping and supporting businesses on our main streets. And when they're selling products, that's when they're going to expand, that's when they're going to hire more people. So this could have a real positive effect on the economy.
What about the folks that would say, especially in the restaurant industry,
right,
that we just cannot afford to increase wages? If we increase wages, we'll just increase prices, and so that positive effect that you mentioned will really null out. Well,
first of all, the restaurant industry does have a two-tier wage system already, but typically when a minimum wage is adjusted in the past, it's done gradually, so there isn't such a shock to the system, and small businesses usually get tax relief in order to blunt whatever impact it might have on them, and I would suspect it would be handled the same way this time.
At the same time, I'm wondering if your friends on the Republican side of the aisle would realize or recognize the argument that if the minimum wage is not increased, who winds up paying the difference? It's the taxpayer in the form of social programs.
Right.
So is that a persuasive argument in the final analysis?
Well, I think it can be, but I think a more powerful argument is it's just fundamentally fair that if someone's working full-time and playing by the rules, they should not still be living in poverty. And right now at $7.25, you have a lot of families living in poverty, a lot of single parents who are trying to provide for their own children living in poverty. And we can do better, and it's time.
Speaking of poverty, we know a lot of those folks are not able or have not been able to obtain health insurance.
Right.
We know that the Affordable Care Act has rolled out in some states very successfully, in other states more challenges. How do we see it rolling out in Wisconsin?
Well, listen, I supported the Affordable Care Act. I thought the current health care system we had was unsustainable. Too many uninsured, rising costs, our businesses less competitive, and our budget deficit spinning out of control. It's not a perfect bill. We're going to have to learn what's working and what isn't and make changes and adjustments along the way. But I know a lot of folks back home who were previously denied coverage because of a pre-existing condition can now get that. A lot of young adults who can stay on their parents' plans through 26. Right. But this will be a process that we ought to be willing to work on together. How do we improve the healthcare system so we get better quality of care at a better price?
But now that healthcare.gov is up and running well, right, relatively speaking, how are folks in Wisconsin taking to the new normal, the new?
Well, it's a lot easier now for them to navigate and go through the healthcare.gov website. It's something that should have been ready come October 1. It wasn't. The rollout wasn't the greatest in that, but the frustration level has come down. And when people are starting to see what premium tax credits they qualify, they're finding it much more affordable than they ever could have gotten in the past.
Wisconsin has not accepted the Medicaid expansion?
Yeah, unfortunately, Governor Walker rejected the Medicaid expansion. Right. He rejected the opportunity for we as a state to establish our own exchange. And because of it, we've got a neighboring state, Minnesota, who are doing a much better job as far as enrollment, as far as the cost of health care because of risk management tools that they have. So it's been a real tale of how differently the states have approached the issue.
It's interesting, some Republican governors, Jan Brewer of Arizona has adopted it, so you just never know. His name is Ron Kind. He is a member of the United States Congress from the great state of Wisconsin. My name is Brad Pomerance. I want to thank you so much for watching Charter Local Edition. We're going to send you back to HLN.
Very good.